My name is Mr. L. Chitumba, specialist medical ultrasonographer and a clinical ultrasonographer. So today, I am going to demystify an illusion that I've seen most patients carry. There are things that if you don't know or if you don't understand, you tend to make assumptions which at times are not so true. So I've seen couples complaining that the machine lied to me in the previous pregnancy that my fetus is a boy. It turned out to be a girl. So in this presentation, I am going to explain to you how it works, how fetal gender or sex determination is done. The machine doesn't talk. It is the operator, it is the radiologist, it is the sonographer or the diagnostic radiographer who does the sonar, who can lie to you if they are not competent enough. So it's true that a bad worker man will always quarrel with their own tools. So today, allow me to introduce you to what is called the Hamburger Sign that is used to determine the female gender. So this is the sign that we use to make a prediction or to determine the gender when the anatomy is developed. So from the second trimester to the third trimester. So basically, when you come for your 20-week anomaly or anatomy scan, the organs of the fetus have developed well and you can visualize the genitalia. So if you're going to see the genitalia in between the legs presenting like a hamburger like this, then you have to know that it's a girl. So now, the Hamburger sign is also called a three-line sign. So on ultrasound, it indicates that the baby is most likely a girl. Depending on the experience of the operator, but this is the most accurate sign for fetal gender determination. So the female sex genitalia essentially appears like a Hamburg, with the clitoris situated between the two labias. So the meat of the Hamburg represents the central portion of the vagina, which is the clitoris that you see there. So let's compare the two. This is the Hamburg here. This is the meat, and then you can see, you compare it here. So you can see the two portions of the Hamburg. This portion again is the sonographic image that we have here. You can see the arrow here is demonstrating the vagina. That's the female genitalia, and you can see the central portion here, which is representing the clitoris. That is also corresponding to the meat on the Hamburg. So the Hamburg sign is very critical in terms of making a diagnosis or determining the female gender. So it is this sign, ladies and gentlemen, that we see for us to tell you that your fetus is a boy or it's a girl. Without this sign, it means it might be a boy but at times, depending on the life of the fetus, you might not be able to see or to visualize a nice hamburger, during which time we allow you to turn the position or to change the position so that you might visualize in between the legs, or else we recommend that you can come back again for the sonar some other time. So here is another sonographic image that is showing the Hamburger sign here. So you can see the two sides of the Hamburg, which are so bright, and then we have got the central portion or central part, which you call echolucent, or the central part which is black, dark, that you are seeing here. That's the vaginal opening. And then these are the thighs that you are seeing, and then the vagina in between. So this is how the female genitalia appears like sonographically. I hope you are making sense of what we are seeing there. I hope it's making sense to you. Don't make assumptions or dangerous illusions that the machine automatically predicts the gender of the fetus. It's an effort that the operator has to take to demonstrate the Hamburger sign. This can also be difficult, especially when the fetus is lying in what we call a breech presentation, like the head is up and then the legs are towards the opening of uterus, or what we call the os. So again, on a 3D image and 4D, if you freeze the image here, that's how we see the gender again on ultrasound. So on a 4D image, estimate a better depiction of the vagina, as you can see there. So you can see the walls of the vagina there, the labias there, and then the central portion, which is the vaginal opening, and then you can see the thighs there, and then the bums there. So this is a nice Hamburg that we have there. So this is a demonstration of a female gender or female genitalia. So how does it all differ with a male genitalia? So what we have here is a 4D image of a boy. So you can see here the two balls there, and then the penis in the front there. So the balls, the raphe of the scrotum, and then you can see the penis there. So for the boy, this is what is called the fetal sign. So an ultrasound, for you to say that is a boy, you must actually visualize or see what we call the fetal sign. So here is the image that you see on what we call the 2D image in black and white. So you see here these rounded structures which are brighter. These are the balls, all the testicles, and at the front there is the penis there. So again, this is what we call the fetal sign. So you can distinguish the Hamburger sign from the fetal sign. So this is what we use to determine the genitalia from 20 weeks going forward. But at 11 weeks to 13 weeks, the first trimester, because the anatomy or the fetal organs are still developing, we can't see the fetal sign in the Hamburger sign. So don't ask for the fetal sign or the Hamburg sign at this early stage. But from 20 weeks going forward, you can ask for the Hamburger sign and the fetal sign, and then your fetus gender will be confirmed. So I thank you so much for watching this video. I hope that I have demystified one of the basic illusions that most people have, that the machine automatically detects the gender of a fetus, of which that's the job of the operator. If the operator knows the sonographic appearance, at the same time knows how to position the patient nicely, they can detect the fetal gender. I thank you all for supporting my channel. I upload more videos so that we all keep abreast with information that helps us on our daily basis. Thank you so much. Remember to subscribe and like our page. Have a blessed day and another days to come. Refer a friend to the channel so that they can also benefit from the free knowledge. Thank you so much.